privilege to be here standing shoulder to shoulder with men and women, not only in the General Assembly, but across the state of Ohio that believe in trusting women with their own bodies. I stand before you as the ranking member on the Medicaid Subcommittee of Finance, as well as the Standing Committee on Medicaid, Health and Human Services in the Ohio Senate. So I anticipate that we're going to be seeing a lot of what is coming over from the House and the committees of which I serve. Now, I stand before you as someone who believes in limited government, someone who believes in empowering local communities and individuals to make their own choices. I believe in rewarding excellence, and I believe in competition. And I'm a Democrat. I know that sounds crazy, but guess what? Guess what? We need a little dose of reality, and I think some of our colleagues in the House need a little dose of reality as well, because last time I checked, members of the General Assembly were not elected to be the sex police. Okay? We are elected, and if we truly believe in limited government, we are here to preserve individuals' abilities to make choices to the best of their own abilities, not to dictate our viewpoints onto the population of the state of Ohio. We are not here to legislate morality. We are not here to legislate personal choices. We are here to provide tools to the population to make those choices on their own. So this is not just about things like Planned Parenthood and other community health centers that provide preventative services, whether it's family planning, breast and cervical cancer screening, basic women's health services, which are all extraordinarily important. And guess what? Women's health is just health. It's not something, weird. Of the population, so 50% of us are getting women's health care. Reality check, right? So not only are we talking about those issues and the importance of preserving access to those critical services, particularly for women that are more vulnerable in our populations, and for young women such as myself and Representative Clyde, who used Planned Parenthood when we were college students. It's very important to continue to provide these preventative women's health services to the general population. But I want to talk just for a brief moment about Representative Antonio's statement regarding gateway, whatever, sexual activity, and this $5,000 fine. This goes back to local control and parents making the best decisions for their children. How many times have we heard folks stand up and say it should be up to the parents to make decisions for their kids? It should be the local school boards deciding what's best for their school district. This issue is no different, and we in the state of Ohio should not be taking away the rights of our school districts and our parents to determine what kind of education, whether it's comprehensive health and sex education or any other kind of education, and dictating it at the state level to our local communities and fining them $5,000 to preserve their decision-making process if they decide in their community that they want to participate and provide comprehensive sex education to their students. That's not what we're here for, once again. So we've heard about Medicaid expansion. We know how extraordinarily important that is, or some of us do, and we certainly will continue to fight. But again, I just want to reemphasize the fact that family planning, women's health care, and access to preventative health care services are not a Democrat or a Republican issue. They're not just women's issues. These are issues that affect families. These are issues that affect all Ohioans. These are issues that impact our economy, our ability to be in the workplace, our ability to pay taxes. And that is why we need to stand up and have our voices be heard. So it's a privilege to be up here.